Growing Up Weird.
Hi, welcome to Growing Up Weird, which is a development and health podcast looking at how early childhood experiences and exposures influence later adulthood health, with me, Greg Dickens, interviewing Gwen Bradbury. This week, we'll be going over an article Gwen has just written called Ozempic. I wonder if you can guess what that's about. I tried, I failed. We're about to find out. But first, we're going to go into some news. My first piece of news this week is one I really like. It took me a couple of weeks to find it, so it's not as fresh a piece of news as normally I try to bring to you folks, but it was hidden because it was in Finnish, and I don't read Finnish. In fact, I read Finnish so badly that when I tell you it was by Hopola, Lepenen and Kosola, you can basically take those syllables and throw them away. I hope I'm getting these authors' names right. They looked at some preliminary information from the PANIC study, PANIC being PANIC, physical activity and nutrition in children, an ongoing study in Europe looking at a whole bunch of 8 to 15-year-olds, and it will be 8 to 16-year-olds and 8 to 17-year-olds as the study continues. And they studied prelim data, as I said, looking at self-reported measures of amount of time spent looking at screens and amount of time spent moving, and compared that to feelings of depression and feelings of anxiety. And there is nothing new at all in if you spend more time looking at screens and less time moving, you are going to feel more anxious and more depressed, or rather, you are more likely to feel more anxious and depressed. And, big surprise, it holds true in 8 to 15-year-olds. We knew that. We could guess that anyway. What is new is they looked at kids who have changed those behaviours. So either increase their amount of time moving or decrease their amount of screen time. They looked at improvement in those outcomes. And you can guess the first bit, right? You decrease screen time, you feel a bit better. You increase movement time, you feel a bit better. What I found really interesting is that the effect is synergistic. So if you increase so let's say, you can't really quantize these things. You can, but I haven't, and I don't think they did. If you reduce screen time a little, you will feel a little better. If you decrease screen time a lot, you will feel a bit better. But if you decrease screen time a little and increase movement a little, you will get a bigger result than doing either of those two things a lot.
So you're telling me it's better to swap an hour of screen time for an hour playing about outside with your friends, but swapping an hour of screen time for an extra hour eating your dinner, not so much benefit?
Yes, that's what I'm telling you, but I'm also telling you that, and take these numbers with a pinch of salt, I'm somewhat spitballing here, but you can imagine that removing 3 hours of screen time might have the same effect on mood as removing 1 hour of screen time and increasing 1 hour of movement.
Oh, okay, I see.
So it's not just a sum; it's a product for my mathematicians. They build on each other.
Yeah.
Which
makes sense because there's a lot of stuff about how screen time is intrinsically really bad, but it's always going to be more nuanced than that, right? So there's what we're saying is there is an opportunity cost of losing movement, which often switches to screen time, but actually, putting the two things back a little bit more into balance is better than adjusting either one factor on its own.
Yeah, I thought that was quite interesting. Synergism.
Yeah.
What about you?
This was one that looked at a lot of parents who had gestational diabetes during pregnancy. And we know that if a mother has gestational diabetes, her children are at higher risk of having metabolic syndrome and of living with overweight and obesity before they become teenagers. Now, that can feel a bit like a life sentence. If you're diagnosed with gestational diabetes, you see all these risk factors, you hear the statistics, that can feel really overwhelming. But what this study by Sun et al., published in the journal Obesity, what this study looked at was they said, what are the modifiable things that those mothers can do in the early life of their children, which reduces the risk of the bad things that come along with gestational diabetes?
Okay. Yeah.
So what can the mothers do to reduce the risk that their offspring suffer some of the consequences? And they looked at two things. They looked at breastfeeding, and they looked at the early life consumption of sugar sweetened beverages and fruit juice. So basically sugary drinks. And what they found was that either, if a mother has gestational diabetes and she breastfeeds, or if a mother has gestational diabetes and she makes sure that her children don't drink sugary drinks, then either of those reduce the likelihood of that child becoming overweight or having obesity by about 50%.
Ooh.
Which is great. Like, what an amazing...
I was just following along, kind of nodding, going, yeah, I know this. Oh, whoa.
Yeah. And that's great. So that was either or. But in the same way we talked about that synergistic effect in the last paper, they also looked at what is the risk of severe obesity if the mother breastfeeds and she restricts sugary drinks. And that is a 400% reduction in the risk of severe obesity, which is enormous. So I just think that, again, that's such a great example of the fact that, yes, we can have this developmental priming, but by making some, pretty significant changes in that early life period, you can dramatically reduce the risk of the child suffering problems.
400% risk reduction.
Yeah.
Okay, I don't even understand how that works mathematically, because I always thought 100% risk of something it will happen.
Yeah. Okay. So I think I've butchered that statistic. I'm sorry about that. What I mean is that the child is 4 times more likely to have severe obesity if the mother didn't breastfeed and they had access to sugary drinks. Yeah. Thank you for... Sometimes the risk increase, risk reduction, I just get a bit tangled.
One is the inside out of the other, and I hate thinking about maths that turn itself inside out. It's horrible.
Anyway, so hope, optimism, great.
I like that. I have a piece of hope and optimism.
Oh, let's do this. What a great way to start a podcast.
I have a piece of non-peer reviewed hope and optimism.
Love it.
Gwen is now looking at me like I'm some sort of bug. Which, if she knew I felt about bugs, wouldn't be the end of the world. I actually delayed recording this for a little bit because I was taking a photo of an insect on the windowsill. Anyway.
Not just an insect, a really beautiful louse. Can I just put this? Beautiful louse, folks. How often do you hear those two words?
It was very pretty. Not a head louse. I want to be absolutely clear here. It was some sort of little bark louse with really shiny wings. Anyway, the photo sucks, just to be clear. Terrible photo. Right, the last piece was in the newspaper Newsweek, which my American listeners will have heard of. The rest of you might not have done. Who knows? They are famous-ish for taking stories and then ringing literally everybody they can think of and saying, who knows a famous doctor who wants to comment on this? And they have, in the past, kind of echoed what everybody else has said about jaw growth and early foods and weaning and all of that, which is dentists were all about the positioning of your teeth is genetic and whether or not you need braces is genetic, and they don't really have much to say about weaning. Recent Newsweek article about 3 days ago, they interviewed a bunch of dentists and every single one of them said that how chewy your early childhood foods alter how your muscles pull on your bones, which changes how your bones grow, which sets you up for less chance of cavities, less chance of braces, better breathing, and better eating in adulthood. So this is huge.
Fantastic.
Now, obviously, this is not peer-reviewed news. What this is, though, is a look at a change in public opinion. And public opinion drives regulation, policy, guidance, all of that stuff. If people are slowly starting to believe the evidence that chewy food in early childhood changes the shape of your face, leading to long-term health outcomes, we might see changes to weaning guidance. We might see changes to dentists telling patients that, maybe if you chewed on chewier foods, your teeth would be slightly further apart and it'll be a lot healthier.
I had a friend who took her kid to the dentist when I think the kid was maybe 2 or 3. The dentist looked at their mouth and they said, someone's going to need braces in 10 years, but you will look forward to seeing you then. Can you imagine how disempowering that was for a parent to hear?
Well, yeah, so this is exactly the thing.
Yeah.
Hopefully, in 10 years' time, dentists won't say that. they'll say, looks like somebody needs to chew on some chewier food so they avoid braces in 10 years' time. So yeah, progress. Little bit of progress.
Can you keep an eye out for a similar article interviewing very well-known podiatrists about shoes? I would be so happy to see that there was a widespread change there.
I will see what I can find. I'll ring up Newsweek and badger them. All right, enough badgering. I don't want to grill Newsweek. I want to grill you, Guinevere, because I have just read your most recent article, which, as I said, was called Ozempic. Great title.
Thank you.
And I think it's a bait and switch. I like an article that claims to be one thing and actually is about something completely different. So, the subtitle for this is, what was it? How to raise children that will never need GLP-1 drugs.
Yep.
Let's start with the obvious. Mm-hmm. For those who haven't, been swept up in the worldwide hype, what is Ozempic or other GLP-1 drugs? So,
GLP-1 drugs are drugs that bind to the receptor of a specific hormone called the glucagon-like peptide 1 hormone. And these drugs make the body do the effect that the hormone usually does. The hormone changes how the gut moves. Specifically, it slows down gastric emptying, does a couple of other things. But we're also recently finding that it actually affects some parts of the brain as well.
Oh, interesting. What can you tell us about the brain effects? That's interesting.
So GLP-1 drugs seem to modulate the dopamine signaling in the brain. And to zoom out a little bit, the dopamine signaling, very simplistically, it is involved in how we sense and respond to rewarding things.
Okay. I mean, I have about the same amount of knowledge around dopamine as your standard internet dweller. I have seen people describe things as high dopamine. In saying that, we are saying they are just very rewarding or feel very pleasurable?
Yeah, absolutely. They make your brain want to seek them again because they release a lot of dopamine, or they trigger a high response to that dopamine.
Interesting. And you're saying that these GLP-1 drugs reduce the binding of that dopamine or the effect of it?
Seems to do a couple of different things. So it may reduce dopamine release. It may also modulate the receptors that bind to the dopamine and transmit the response.
Fascinating. All right, well, hang on. That sounds unfun. Specifically, getting in the way of having fun. Why is it that people want to take these drugs?
So these drugs have been around for 15 to 20 years. So they're not a new drug on the block. They've been used for type 2 diabetes for a long time. But what has changed very recently is that a couple of big studies came out, and then the indications for the drug changed to say that the drug could be used specifically to help with weight loss.
For anybody who doesn't work continually with the pharma industry, indications are the list of things you're allowed to use the drug for, or that you might be prescribed the drug for. Mm-hmm. So that now includes weight loss, yeah?
Yeah, and that's why these drugs have really hit the headlines, because there have been many drugs over the years that were thought to help with weight loss, and they seem to show promise. Some of them even hit the market, but then were withdrawn because they had really bad side effects. So the fact that GLP-1 drugs, which have this history of pretty safe use, are now indicated for this and seem to have pretty impressive effects at helping people lose weight. That's why there's been so much excitement. That's why there's been so much prescription. That's why there's been so much media hype. Okay,
well, that sounds great. An effective, safe drug that helps people to lose weight. Mm-hmm. And you said they can also reduce the likelihood of diabetes.
Yep.
Right. So far, I'm not seeing the downsides here. Why aren't they right for everybody? What's the whole point of writing an article about helping kids avoid them?
I mean, at an individual level, if you have been struggling with your weight for a long time, or if you have diseases relating to your metabolic health or to your weight, then they make an awful lot of sense. Yes, there are some side effects. Those can be pretty unpleasant, but...
Hang on. You don't get away with that easily. When you say there are some side effects, they may be pretty unpleasant, and then try to move on to the next sentence, I have to throw a spanner in that particular work. Are we talking like Olestra side effects?
No, for anyone who doesn't know, Olestra was another...
It was a weight loss drug. It was intended to be a weight loss drug, and then it was moved into the food industry because it sucked at being a weight loss drug.
Yeah. What did it do, Greg? What did it do?
Okay, so Olestra was a fake fat. It was an oil that the body couldn't digest, which sounds great. You chuck on as much oil onto your food as you like, and it doesn't have any calorific output. But if you imagine what would happen if you put a bunch of oil in that you couldn't digest, it comes out the other end undigested, as explosive, violent, greasy outcomes. I used that last word advisedly.
Horrible.
Thank you.
Thank you. That's so evocative. Absolutely vile.
So, okay, we're saying it's not as bad as all that.
No, not at all. But what it does for quite a lot of people is it gives them a lot of nausea. Some people have vomiting. Some people have diarrhea. Some people have constipation, and those side effects are not to be overlooked. A friend of mine who's taking Ozempic, she said that yes, she's felt pretty grim for the whole time she's been on the drug, but she has lost so much weight. It's absolutely transformational. It's life-changing. And I think that is one of the things about this drug, especially it's being used for type 2 diabetes. It's being tested for basically all of the modern diseases of our time: liver disease, heart disease, kidney disease, dementia, all of these. And yeah, it's all great. There are lots of health outcomes that might improve. But in the very short term, people see that they lose a life-changing amount of weight. That's why people stick with it, even though some of the side effects are pretty awful.
There's a side effect I remember from the first generation of dopamine blockers. There was a big drive into finding ways to fight addiction when the opioid epidemic in the US really kicked off. And one of the ways you can fight addiction is to block the system that is otherwise giving you pleasure from these drugs. Yeah, and by these drugs, I'm talking now about opioids, not GLP-1 drugs. And that's great. It stops you getting high from various things, but it also stops you enjoying basically anything. They were withdrawn from the market pretty darn quick because they raised the rate of suicides. Now, I'm aware that the effects that GLP-1 drugs have on dopamine are not quite as drastic as completely blocking its reception, but it can't be fun having your dopamine system damped.
Yeah, absolutely. And there's a lot of kind of controversy, conflicting results over the effect that GLP-1s have on people's mental health. And we know that they are much less bad. They've got such a long history of use. We know that they are much less bad than some of the drugs that you're referring to. But even if they're not changing the risk of suicide, people are still reporting that actually some very fundamental behaviours that they've always taken a lot of pleasure in are being fundamentally changed. So this might be that, maybe someone doesn't fancy their morning coffee as much. It may be that actually they no longer want to drink alcohol. They find it easier to give up cigarettes. So it may even be that they don't really feel motivated to cook for their family anymore. There are lots of pieces of our lives that rely on having a reward system that's tuned to the right level. And GLP-1 drugs, they're quite a big hammer to try and adjust this very small, very sensitive nail with. Interesting.
I guess thinking about it, the other reason you might not want to be dependent on GLP-1 drugs is that they are really pricey.
They are really pricey, and they're also pretty hard to come by because there have been so many supply issues. But actually, Ozempic comes off patent in 2032. So what typically happens when drugs are no longer on patent is they become a lot cheaper. So I think actually cost and accessibility are going to become much, much easier within the next decade. But even so, there are still, even if those aren't big barriers, that alteration of how you process pleasure, reward, and good feelings
is worth avoiding.
That's still worth avoiding.
All right. Well, that brings us then to the question of the hour. How do you set up people to avoid it? How do you raise kids that will never need GLP-1 drugs?
Great question. we talked about the indications, right? We mentioned weight loss being a big one.
Yeah,
when we talk about Ozempic, most people are probably going to think, oh, what you're saying is, how do we raise a child that never develops obesity?
And that is what I thought when I read your article.
Absolutely. It's kind of a red herring. I'm going to talk about it very briefly, but I'm going to focus on the more interesting piece in a minute. So, your question was, how do we raise kids who don't need Ozempic? Well, if actually the question was, how do we raise children who are protected against obesity? Well, we understand there are lots of different aspects that can contribute towards that, making sure that children have the knowledge to prepare their own food.
Hang on, kids that cook their own food surely have access to more food. How is that going to help them not be obese?
Being able to cook your own food means that you are able to make good, healthy, nourishing food from ingredients that you can access. You aren't dependent on ultra-processed food to the same extent.
Okay, ultra-processed food raises its head again. For those who weren't listening, the last time we raised ultra-processed food, we're talking about food that has been broken down to its finest constituents, and by finest I mean smallest, not finest as in mwah, chef's kiss. Bellissimo. I'm talking about stuff that has been broken all the way back down to a powder and then mixed up into a gunk and then cooked. Monster Munch or various biscuits or various cereals or most food eaten in the Western world. It's the sort of food that breaks down very rapidly into nutrients, smashes its way into your liver, upsets your liver, and then doesn't give your gut microbiome or the rest of your body really what it needs.
Yeah, and the other piece of that is not only are we eating foods that are lots of different deconstructed ingredients, but also the deconstructed ingredients that have been seasoned and tweaked to perfection to hack our palate, our taste and reward systems.
That dopamine system.
So we believe it's absolutely delicious. Absolutely, they're designed to be extremely rewarding, very stimulating of your dopamine system.
So if you set up kids that will not need to rely on them, what does that do to their dopamine sensitivity, I guess?
It helps the reward system and their dopamine sensitivity calibrate to a normal level of reward. The level of reward from eating an incredible strawberry rather than the level of reward that comes from eating an incredible ice cream. And I don't use the word incredible lightly. Yes, there are some incredible ice creams in this world, but those have been very, very, very specifically designed to make all of my systems fire.
Okay, so that's tip number one then. Teach people to cook. What's next?
The second piece is to think about how we set children up to have functioning reward systems. So one of the reasons that we focus on obesity and overweight here is because these are challenges that are socially judged, that affect enormous proportions of people in the Western world, it's almost easier to have these syndromes than not within our culture. And so it means that there are lots of reasons why weight is stigmatised and people are desperate to reduce it. That's why we link Ozempic and food. Actually, if our culture was a bit different, maybe we'd be linking Ozempic with a completely different abnormality of our reward system. It's just that food is the most obvious one within our own culture.
Okay, so you've talked about how ultra-processed food comes in and sets your dopamine requirements or expectations higher than our normal food would do. And now you're talking about setting up a dopamine system that works properly. How do you do that in practice?
I'm going to take a step back to answer that question.
Okay.
And that is because about 5 years ago, I worked with a company that sold products to help people give up smoking. And I learned two facts when I was working with this company. One, that the earlier a child is exposed to an addictive substance, the more likely they are to become addicted to that substance.
Okay.
That's fact number one. The second fact is that when a child is addicted to one substance, it is much easier for them to become addicted to another as well.
Ooh. Okay, I knew fact number one. I didn't know fact number two.
Yeah. But what that means is that when a child's brain grows around something that is giving it an unnatural degree of reward, that alters the whole way that the child thinks. And that means that because it's grown in this way around this abnormal reward system. Anything else that also delivers an abnormal level of reward is more likely to be able to kind of fit into that dysfunctional reward system.
If you flip that on its head and say it's not just that anything else that gives an abnormal level of dopamine can trigger it, it's that nothing else that doesn't give an abnormal level of dopamine even gets a look in anymore. Yeah, that fits into my head a whole bunch better. That's horrible.
Yeah, it is really horrible. But what we can learn from those two pieces is that we all know this anyway, we want to do everything we can to reduce the risk of a child getting addicted to any one thing.
Sure. Take away the cigarettes. 1908, Children of Tobacco Act.
Thank you very much.
Thank you.
And we also want to delay their exposure to addictive substances. Every extra week, month, year that reward system in the brain is growing around a normally calibrated system of reward, the harder it is for something that is disruptive once or twice to kind of get a foothold.
Yeah. I mean, it's the same with calibrating any learning sensor, right? That the first time you calibrate it, you can knock it right out of whack. But if it's got 100, if it's got 1,000, if it's got 10,000 calibrations on board, it's very hard to change its mind. Interesting.
Yeah. So we're trying to delay the exposure of children to addictive substances for as long as possible. What do you think in Western culture, Greg? What are the addictive things that we give to our kids?
Well, yeah, I'm somewhat cheating here because I did read your article and I read the bit where it said that keeping kids away from class A's is a red herring. This is not about stopping your kid from getting hold of methamphetamines. Let me see. I'm guessing that sugar plays a big part here.
Yeah, sugar really does play a big part here. So we know that children who have high sugar consumption in early life are more likely to have addictive disorders in adulthood. And obviously there are confounders going along here, socioeconomic status being a big one, but even in studies where they control for that, there's still a strong association.
Wow, okay. Guess number 2, currently I'm 100%. Let's see if I can keep that up. Screen time?
Yeah, so again, there is nuance around screen time, but the challenge is that, well, obviously different kinds of screen time can do different things, but in general, for a digital media to be successful and to capture attention in this very busy world, typically people put an awful lot of effort into making sure that these forms of media are as engaging and as rewarding as possible.
Oh, you had a phrase for that in your article, didn't you? Dopamine engineered.
Dopamine engineered, exactly. I mean, it's not even an open secret. It's not even a secret at all. This is just how you keep your products relevant. But the challenge with that is it just sets an unreasonably high level of for what your brain deems as entertainment.
Yeah, so working in innovation consultancy, which is a big word for I help people solve problems, there are a lot of companies out there who loudly and proudly shout that they are dopamine engineers. They will optimize your whatever it is, your user experience, to cause as much dopamine release as possible. That is their single purpose as a company. And I will admit that until this evening, I was very pro dopamine engineering. I thought it was a good way to keep people engaged. But I hadn't really thought about the effect on a developing brain.
Yeah, absolutely.
Interesting.
The final one, which you might not have thought of so rapidly, but it is something that I found pretty surprising.
Go on.
Toys.
You're right. I would not have got there.
No, and I think I made the point in the article that we Western adults love giving toys to children. Probably because it also gives us a really strong dopamine hit, a reward thing. Oh, look how excited our child is when they've got this toy. But the challenge that happens, the more toys you provide and the less a child has to interact and engage with those toys, the more they can get a small hit from doing a little interaction, then moving on, then moving on, then moving on. You're teaching a child to be craving and seeking the next hit. And so there are studies looking at the amount of time that children play with toys, the ways that they interact with toys, depending on how many they have. Having loads of toys is really bad for helping a child to get the reward of engaging with any one of them.
Okay, first, I love the idea of being a toy play researcher. That sounds like a dream job. That sounds like the sort of job a 6-year-old would say, when I'm older, I want to play with toys all day. And actually clung to that, put it in their heart and held on to it. Got to university and went, right, now's my time.
Digger drivers, toy play researchers, right?
Train drivers, I assume some pilots, and the occasional vet.
Yeah, don't.
Yeah, if your kid wants to be a vet, definitely get them to talk to me first. Okay. So these are things that you can do to help kids level their dopamine reactivity. If there's a better way of putting it, please tell me. But in so doing, you help them to what? Find joy in normal things and not be craving that massive release of dopamine from dopamine engineered food, media, and engagement with toys.
Yeah, absolutely. They get the dopamine response, sense of reward from working, engaging, doing something to get that reward, rather than kind of from passively consuming.
Fascinating. Well, that kind of wraps us up on what GLP-1 drugs are, why you might not want everybody in the world to be taking them, and how you can give your kid or a kid under your command the best possible shot at not needing them ever. What have we missed?
I think I would actually wrap this up with a little bit of a focus on actually what you do. We've said what are the big addictive things that children are exposed to within our culture, but I guess flipping that round on its head, what does that mean? It means keep kids off sugar as long as you can. As I said before, every day, every week, every month makes a difference.
It's that sense of calibration thing again.
Yeah. Ultra-processed food, obviously if you're avoiding sugar, then you end up avoiding 75% of ultra-processed food anyway. But for the remaining 25%, you want to restrict it as much as possible. Help kids to develop a sense of taste that is around fruits, vegetables, minimally processed foods. You can have ultra-processed foods, fine occasionally, but you really don't want to make them into a treat or something that you give the child as a reward. They should be, if you're going to eat them at all, they're just a thing that you eat when you don't have something else to eat. Fine.
Nice. Ration packs,
exactly. 3, screen time. Just like with sugar, you want to reduce it as much as possible for as long as possible. That's going to differ for each person, but again, day, week, month helps.
Fascinating.
And finally, toys. It is really hard to get toys out of the house, but it's much easier to stop them going into the house. So prune your toy collection. Ask friends and family not to give toys at birthdays. Keep the toys as something that you have when it's too miserable to go outside, not as something that is a focus for a child's daily life.
I mean, that sounds a little bit anti-consumerist and anti-Western imperialist capitalist. So I am all here for it.
I'm just thinking about the number of toys we saw when we were travelling South America and Africa. Yeah, probably. I think you can count on the I would say fingers of one hand. I just remember the little spindly wheel tricycles in Tanzania.
Yeah, spindly wheel tricycle. I saw a kid with a doll once. And there were plenty of balls.
That is true. Do you remember the ones in Ghana that were made out of the water bags?
Tied together.
Yeah. And the skipping ropes made out of the water bags. Yeah.
If you have access to an enormous quantity of empty water bags, you learn to make things out of them. Yeah,
incredible craftsmanship, I would say. So yes, kids make their own toys. Fine. But there's certainly, like, in terms of volume, in terms of the amount that they are designed to engineer a dopamine system, balls are pretty good.
Yeah, sure.
Movement outside, great.
No loud flashy lights or twinkly noises.
Yeah.
Okay, thank you for that. That was cohesive and complete. I liked it. Time to wrap up with one question, but before we do, I've just got to say that this topic was suggested by Gwen. However, there are other topics out there and they're not all in Gwen's head. She's nodding at me here. So please, if you have requests for topics, we've had requests for gut development and health. We've got requests in for fine motor skills, fertility, and all sorts of things. But what do you want to hear about? What is it that you need to know? Write in and tell us. All right, let's finish up on this question. The question is, Gwen, you mentioned in your Gut Feelings article that people suffering from IBS in adulthood were more likely to have had sickness behaviours reinforced or modelled in childhood. How do I avoid reinforcing or modelling sickness behaviours to my children?
Oh, great question. So, the challenge with illness behaviours in adulthood is a proportion of them are learned. So you watch adults to see how they deal with discomfort and pain and feelings of illness, and as you yourself grow up, you then start to replicate those same behaviours around illness. If a parent reinforces the sickness behaviour of a child, it means that they give the child treats or give the child rewards or pay the child extra attention when they're feeling ill. Now, obviously, as parents, we really want to look after our children. That's really important. But to avoid reinforcing behaviours, try paying attention but distracting the child, helping them think about something else. Affirming that that it must be really tough to be managing it, but that you are impressed that they're doing so. Help them to see a journey away from the sickness behaviour rather than have that sickness behaviour as being the thing that is rewarded. And avoiding modelling sickness behaviour, again, that can be really tricky when you're feeling ill and unwell, especially when you have a chronic condition. But just because you know that the children are watching and learning from how you deal with illness, it's really important not to identify too much with the illness, not to discuss it too much, other than discussing it in terms of how you are dealing with it or how you are coping with it. Does that make sense?
Does to me. I hope it does to our listener as well. Right. Thank you very much for talking to me, Gwen. It has been fascinating as ever. I feel like I've grown as a person. Seriously, I do. Learning from you is fascinating. Until next time, you have been listening to Growing Up Weird with me, Greg Dickens, and Dr. Gwen Bradbury.
Bye.
Bye.